Good afternoon, everyone. Thank you so much for joining us for our second Facebook Live during World Breastfeeding Week. My name is Gabby, and I am here with Dr. Monica Kelly, who is a pediatrician at Boys Town Pediatrics. So today we are going to be talking all about supply. So milk supply, when it comes in, everything about it. So if you have any questions about supply during breastfeeding, please feel free to comment them in the comment section of this video, and then we can get them answered at the end. And also, if you look above this post, there is an RSVP link. And if you go ahead and fill that out, we are giving away different items every single day this week to celebrate World Breastfeeding Week. So today we are giving away a bumbo seat, which is super fun. So if that is something you are interested in winning, go ahead and fill out that link, and we are going to be announcing the winners in the Facebook event page on Friday. Okay, Dr. Kelly, how are you doing today?
I'm well, thanks. How are you?
Great. Thank you for joining us. It is always great to have a few different pediatricians throughout the week kind of give their expertise and their insight based on interactions they've had with patients and everything like that. So we really appreciate you hopping on. Okay, so let's talk about milk supply. So we have a series of questions we're just going to talk back and forth on. And then, like I said, if anyone watching has questions, let us know in the comments. Okay, so first off is, when does milk typically come in?
So, right after baby's born, you already have some milk, which is called colostrum, but it's a much lower volume. And then around day 3 is when a sort of more amount of milk comes in. But it's just important to know that people talk about when milk comes in. You have milk right in the beginning. You have the right amount for baby from the very beginning. But just the bigger volume of milk comes in around day 3 for most people.
Great. How long does it take for that milk supply to regulate?
So for about the first 6 weeks, your body is still kind of trying to figure out how much milk to make for baby. At 6 weeks, it gets much more regulated.
How many times should mothers feed their babies during the first few days of life? And then about how long would you say do they nurse each time?
So we definitely recommend that you feed kind of on cue. So really pay attention to your baby and feed them whenever they seem like they're hungry. And you want to try to feed them before they get cranky and cry. So just when they're kind of rooting around and touching their mouth and things like that. It typically ends up being about 8 to 12 times in a 24-hour period that they want. They'll go through little periods where they cluster feed, and they'll want to eat a lot more often than that. And then they'll have little stretches where they go longer without eating. Typically, they'll eat from about 10 to 30 minutes at a time. And they show you the cues before that they're hungry, and then they should seem relaxed and satisfied when they're done.
Yeah. So in that, did you say 8 to 12 times about?
Yeah, about 8 to 12 times.
Okay, so within that, what about during the night? Do you wake up the baby when it's time to feed?
So most babies are more awake at night initially, because they're used to being rocked during the day when you're walking around. So they sleep during the day and they're awake at night.
Right.
So most babies don't need to be woken up at night to eat because they'll wake you up.
Yeah.
But so it's normal for babies to lose weight initially, but until they're back to their birth weight, we don't want you to go longer than 3 to 4 hours without feeding them. So if your baby was to, I keep saying your baby, but anyway,
Everyone,
if a baby was
general.
more than 4 hours, I would wake the baby up until at least they're back to birth weight.
Okay, good to know. So how can moms know if their baby is eating enough?
So for the first couple of days of life, we track how often the baby pees and poops really carefully. And you want the baby to pee at least as many times as they're days old until they're 4 days old. So like the first day they should pee at least once, the second day at least twice. And then once they're 4 days old, going forward, they should pee at least 4 times a day. And that just shows that they're not getting dehydrated.
Mm-hmm.
Then we want them also to poop about that many times, but poop is a little more variable.
Yeah.
Then when they eat, you want to see that, do they seem satisfied after they're done? So they should, at least for a little bit afterward, be less fussy and seem content. And then we also track their weight really carefully. So, in the hospital, we check it, and then we have them follow up a few days after they leave, and then set intervals after that to make sure they're getting enough.
Yeah. So talking nutrition-wise for mom, what should mothers pay attention to while monitoring their supply when it comes to their nutrition and what they're eating?
So nutrition while breastfeeding is very similar to nutrition at any time. I mean, you want to make sure you're getting, a well-balanced diet, getting your protein and all your vitamins and things like that. Staying well hydrated is really important for supply, so drinking plenty of water. And then you need a little bit of extra calories while you're breastfeeding, but unfortunately, it's not that much more. It's about 300 extra calories a day, which people get just because they feel hungry.
Right.
But it is good to know that your body sort of preferentially makes the milk. So even if you're not eating the healthiest diet, your milk is still going to be healthy for baby. We want mothers to eat healthy diets for themselves, but they don't feel guilty if they eat something that they don't think is the healthiest thing, because your body will just give the good stuff to baby.
Okay, that's great to know. So this is a common question that we got about this topic. What tips do you have for managing over and under supply?
So breast milk production is all about supply and demand. So especially if you think about undersupply, the thing that affects it absolutely the most is just how often you empty the breasts. Mm-hmm. So how often you're nursing baby, or if baby doesn't have a very good latch initially, doing some extra pumping to help sort of tell your body that it needs to make milk. That's the best thing for supply. And then other things that are really good for it are drinking plenty of water, getting sleep, which is kind of hard to do when you haven't before, but if you can get some help, get some sleep, that's a really good thing. And certainly, eating enough that you don't feel really hungry. You don't want to everyone wants to lose weight after they have a baby, but you don't want to lose it too fast, because you need to have nutrition for baby. Mm-hmm. And then oversupply, it's the same sort of thing. So you want to decrease the stimulation. So if you were pumping, to build up a milk stock for going back to work or something, you should stop doing that. And then if it's still, so often the biggest problem with oversupply is that the milk comes out really fast. And so I'm a little frustrated with the milk coming out too fast. So if you change your position so that the milk is kind of going uphill to get baby, so you're leaning back and baby's on top of you, that can just help with it coming out too fast. And then to help your body down regulate, you can put, so instead of, normally we recommend feeding on both sides each time. Mm-hmm. But if your supply is too high, if you just feed on one side each time and then wait 3 hours before you would feed on the other side. So if baby's hungry again within the 3 hours, you would feed on that same side. And that just kind of helps tell the side that you're not feeding on that it doesn't need to make milk.
Right. Yeah, that's interesting. I didn't know that. That's good to know. Okay, so we do have one more question on our list, and then I do see one in the comment section. So for anyone watching, if you have a question for Dr. Kelly, now is the time to comment it so we can get it answered. Okay, so our last question is, when does a mother's supply typically dry up? I'm sure it's a little bit different for everybody, but...
Yeah, so it really depends on how much baby's eating and how much so I would say it's different if you're just totally breastfeeding baby or if you're back to work and pumping. The way it's still as long as baby is breastfeeding or you're pumping, you're generally going to make milk.
Right.
So even, people can nurse their children until they're 3 years old if they want to. Their body will keep making the milk. But as the baby starts eating more and more solids, you generally make less and less milk. So most babies get that, we recommend doing just breastfeeding until 6 months old. And then from 6 to 9 months, other food is just kind of for fun and for teaching them how to eat.
Mm-hmm.
And then 9 months to a year, it's really when it transitions over so that they're getting a lot more nutrition from food, and then you tend to have a lot less milk.
Great. Okay, so we're going to move over to the comments now. So the first question says, I've heard of people using lactation support supplemental drinks, etc., to increase their milk supply. Is this needed or recommended? With that being said, there are numerous articles on fenugreek actually making breastfeeding more difficult, if you can talk on that.
Yeah. So I have read exactly the same sort of things this commenter has. So
Yeah.
there are a number of supplements that are advertised as being good for milk production. Like any herbal supplement, it's not regulated, so it's a little harder to do studies on it and things like that. The studies that they've done on those supplements haven't shown a great response. And they did show that they cause a lot of side effects, especially on mom, but it can also make baby more cranky. The side effects typically gets, like with the fenugreek, is GI symptoms, gasiness and things like that. And just the discomfort that both mom and baby feel probably do make breastfeeding a little more challenging. And for most people, the vast majority of people, they do not need supplements to help their milk production as long as they're feeding baby often enough or pumping often enough.
Great. Okay, so the next one talks about colostrum. So she says, I missed the mention of how early you start producing colostrum. Should I be trying to stimulate that pre-birth?
So most people start producing it around 36 weeks. You can start expressing colostrum before baby's born, but you don't want to do it until much closer to birth because breast stimulation can actually induce labor. So start doing it until you're ready for baby to be born, basically. I would say wait until at least after 38 weeks before you do it. And then, the benefit of that is that if you then save it, you have a little bit to give baby. But most people produce plenty of colostrum and don't need to have extra.
Great. Okay, and then the last question here is it best to pump right after a feeding to help stimulate, and should I pump every time?
So again, as long as your baby latches well and you're feeding them every time they seem hungry, most women will produce plenty of milk without ever using the pump. And it's certainly more comfortable for mom not to use the pump, less work, and you don't risk producing and making an oversupply. Only start using the pump if your pediatrician or OB or someone else, talked to you and said, like, we feel like you're having an issue with supply, so you should start pumping right away. Otherwise, it's better to wait until the breastfeeding relationship is a little more established, and then you risk inducing an oversupply less.
Great. Well, thank you to everyone who asked questions, and we are going live over lunch the next few days this week through Friday. So if you are watching and you think of a new question or you have one that you didn't get to ask, feel free to either message our page with your question or go ahead and comment them on our live stream tomorrow or Thursday or Friday. So I want to mention too with Dr. Kelly that Boys Town Pediatrics does offer free pediatrician meet and greets. So if you're watching this and you're expecting baby, you can set up a free meet and greet with Dr. Kelly. So I can link that form in the comments section too. So Dr. Kelly, thank you so much for talking about milk supply. It is super helpful, I know, for all of those breastfeeding or soon to be breastfeeding moms out there, and we really appreciate it.
You're welcome.
Awesome. Well, thank you, everybody. We will see you tomorrow at noon for our next topic. Have a great day.